Heart attack. Cardiovascular disease, which includes heart attacks and other issues like strokes, is the leading cause of death worldwide, taking the lives of almost 7 million people each year. What then triggers a heart attack? The heart requires oxygen just like any other muscle, and during a heart attack, it runs out. On the walls of our coronary arteries, fatty deposits, or plaques, form. The heart receives oxygenated blood from those arteries. As we age, these plaques enlarge and can become thick, hard, or inflammatory. Plaques may eventually develop into obstructions. An artery can become entirely blocked if one of the plaques ruptures or splits because a blood clot will grow around it in a matter of minutes. The heart muscle is deprived of blood flow, and the oxygen-starved cells begin to die within a few minutes. This is a heart attack or myocardial infarction. Plaques may eventually develop into obstructions. Things can quickly deteriorate in the absence of therapy if one of the plaques ruptures or breaks. The blood pumping capacity and rhythm of the damaged muscle may be compromised. A heart attack has the potential to result in abrupt death. How can you recognize a heart attack in someone? The most typical symptom is chest pain brought on by the heart muscle's lack of oxygen. Patients say it feels like a squeezing or vice. The left arm, jaw, back, or abdomen may also be affected. Plaques may eventually develop into obstructions. However, it's not always as immediate and dramatic as it is in movies if one of the plaques ruptures or cracks. Some people feel queasy or have trouble breathing. In women and the elderly, symptoms could be less noticeable. The primary indicator for them can be weakness and exhaustion. Surprisingly, a heart attack may be silent in many people, especially those who have diabetes, which impairs the nerves that transmit pain. The most crucial thing is to act fast if you believe someone may be having a heart attack. Plaques may eventually develop into obstructions. If one of the plaques ruptures or cracks, call emergency medical services if you have access to them. They are the quickest method of reaching a hospital. A heart attack can be prevented from worsening by taking aspirin, which thins the blood, and nitroglycerin, which widens the artery. Doctors can identify a heart attack in the emergency room. They frequently perform an ECG to gauge the electrical activity of the heart and a blood test to evaluate any damage to the heart muscle. The patient is then brought to a state-of-the-art cardiac suite for diagnostics to identify the blockages. In a treatment known as an angioplasty, cardiologists can unblock the blocked artery by inflating it with a balloon. They frequently also install a stent made of metal or plastic to keep the artery open. Coronary artery bypass surgery may be necessary for more severe blockages. Heart surgeons can reroute blood flow around the obstruction by using a segment of vein or artery from another bodily area. These methods restore heart function by re-establishing blood flow to the cardiac muscle. Although heart attack treatment is improving, prevention is still essential. In a treatment known as an angioplasty, cardiologists can unblock the blocked artery by inflating it with a balloon. They frequently also install a stent made of metal or plastic to keep the artery open. Coronary artery bypass surgery may be necessary for more severe blockages. Heart surgeons can reroute blood flow around the obstruction by using a segment of vein or artery from another bodily area. These methods restore heart function by re-establishing blood flow to the cardiac muscle. Although heart attack treatment is improving, prevention is still essential. Vegetables with a lot of fiber, poultry and fish instead of red meat, whole grains, and nuts like walnuts and almonds all appear to be healthy choices. Maintaining a healthy weight and engaging in regular exercise can reduce your risk of heart attack and help you maintain a healthy weight. Of course, drugs can also lower the risk of heart attacks. For instance, doctors frequently recommend low-dose aspirin, especially to people who have already experienced a heart attack and to people who are known to be at high risk. Additionally, heart attacks will be less likely if you use medications that lower risk factors like high blood pressure, cholesterol, and diabetes. Even if heart attacks are frequently, they don't have to be unavoidable. Making sure your body's most vital muscle continues to beat can be greatly helped by maintaining a nutritious diet, abstaining from cigarette usage, staying active, getting plenty of sleep, and laughing a lot.